करना है क्या? अच्छा, this stream. Hi, Dr. Sewanti. Thank you so much for joining Free Press Journal. Thank you for your valuable time.
Thank you for having me, Rashita.
How have you been? All good?
Yes, it's a regular day, hectic, chaotic.
Doctor, as I was speaking to you about a lot of diagnosis happening in recently, especially with actresses and younger actresses either losing their life to cancer or coming out and openly talking about uh, breast cancer, and it's at stage 3, it's at stage 4, and it's very heartbreaking to witness all this as of course the head of oncology at Reliance Foundation Hospital. You have dealt with so many cases in your career. What do you think is the reason behind the increase in these diagnoses?
So the world is witnessing rise in cancer cases. Uh, a lot of this is thought to be environmental pollution. A lot of it is also something called epidemiological transition, which I've talked about a lot earlier. India is also facing that as chronic communicable diseases go down in number as we treat our tuberculosis, our HIV better. People live longer, and as we live longer, we then succumb to a disease which is of aging population, and that is cancer. What is most, um, I would say, a matter of research at this juncture is why such a high percentage of young people are getting diagnosed with cancer. That is truly a matter of study, a matter of research, because other than that, epidemiological transition where a country lives a better life, longer life, where other chronic diseases like infectious disease, diabetes, neurological diseases can are getting treated better. People are living longer. Young lives due to infections are getting lost much lesser. That's where increased number of people are living today to get diagnosed with cancer. So that truly is one answer to higher numbers getting diagnosed. Why are we hearing about cancers much more than earlier? I would
Yeah,
think that that is also because of a lot of transition that has happened in the society, where
correct.
people are much more open, people are communicating. Cancer is an epidemic. We have very high numbers happening, playing out in societies now, and people are coming out to help each other, own up, discuss with each other, and participate in each other's journey to help improve outcomes. So I feel it is actually only going to do good to our society, and it's going to help with raising cancer awareness. It's going to help with people going and owning screening. It, I hope that it would revolutionize the concept of cancer screening in early detection, which ultimately is going to transform cancer related outcomes.
Absolutely. Another thing that I've noticed in the recent past is that when people are coming and talking about it, like Hina Khan, when she spoke about being diagnosed with stage 3 breast cancer. Another actress last week recently opened up about her name, Tanishta Chatterjee, stage 4 breast cancer. So when you reach stage 3 and stage 4 without knowing, firstly, how is that possible? Does your body not signal? Secondly, what is the precaution that you can take? What are the tests that you would suggest to, go and get so that we are aware of what's happening in our body?
So, actually, incidentally, both the people that you're quoting here are young people. They are both with aggressive breast cancers. And when someone has aggressive disease, it's actually something that's moving very fast. Even as you realize, routinely that there may be a lump in the breast, by the time you really understand, comprehend, and are able to raise a red flag, the cancer is already on its journey. So I think that is to be understood, where we have to realize today that not all cancers are similar. Not all breast cancers are similar. There are very, very different kinds of breast cancers with different kinds of therapies. And by the same token, uh, even when people are diagnosed with locally advanced or advanced disease, it is important to realize, internalize, orient that all advanced cancers are not similar, and there may be a silver lining to the case which appears locally advanced or advanced, and you need to figure out that silver lining. You need to figure out that biomarker. You need to figure out that gene or that protein that defines that patient, to be able to treat better and to be able to treat for with transformative results, to be able to treat maybe even for cure in locally advanced or advanced disease.
Celebrities are often linked with having a very nice lifestyle in terms of healthy eating. Of course, they take care of their bodies, they work out, but at the same time, they're often linked with consuming alcohol or smoking or doing things that are injurious to your health. Uh, how much is a healthy lifestyle related to, cancer? And can smoking, can drinking, can consuming any sort of drug also increase your chance of having this disease?
So I don't want to uh, refer to this as only for celebrities. This is for all of us. Alcohol and smoking are red flagged by American Cancer Society. Any level of alcohol, any level of smoking, any level of tobacco, even chewing tobacco or any kind of other utilization of tobacco, has been marked off by American Cancer Society and multiple other global regulatory leaders as being carcinogenic. So, direct cause and effect, direct causation of cancer by exposure. Red meat is the third one. What we truly need to know is that um, when we have people who are living healthy lifestyles, even then cancer can happen. So when someone gets diagnosed, it's not just these three or four red flags that we look at. Even regular normal people can get cancer. Many cancer patients have cancers running in their family, and they are at high risk. I'm at high risk. I lost my mother from lung cancer. I have my family member with advanced breast cancer. I'm at high risk. I screen myself all the time. And similarly, anyone who has a family history must be screened for genetic risk of cancer. And they should also be participating in yearly screenings very, very diligently. And Hina in this footage looks so lovely.
She does, she does. Um,
Congratulations all over again to her and Rocky.
Absolutely. Um, Fighting cancer, of course, is a mentally very challenging thing. But a lot of times, I've heard so many doctors say that early diagnosis can save your life. So you just spoke about screening yourself. Um, what do you suggest when you have a history running in your family? How do you suggest what's the age that a person should start at? And what is the process like? If in layman's language, you could explain it to our audience.
Yeah, sure. So, there are age appropriate screening measures, which I say start from your head to toe. And there are certain cancers that are already approved for screening, beginning with oral cavity, for especially for those who participate in tobacco chewing or smoking or alcohol. They must undergo a proper yearly or even 6 monthly oral cavity examination. Then any symptoms from in the neck or lung, you need to get to a doctor and you need to get examined. If there is a history of cancer in the family, what kind of cancer, so that also plays a role in identifying what other cancers are is a person at risk for. But of course, yearly mammogram, sonogram for bilateral breasts, both the breasts, especially after the age of 50. If you have a history of cancer, breast cancer, ovarian cancer in the family, there is a syndrome called hereditary breast ovarian cancer syndrome. For these folks, we advocate starting 10 years earlier than the designated patient. So the patient got diagnosed at 40, the family member should start screening at 30. Otherwise, even at 40, if there is someone who has multiple family members with breast, ovarian, they should start screening at 40 years of age. Yearly bilateral mammogram, sonogram should happen. For the ovaries, ultrasound of the abdomen and pelvis is advocated, blood tests are advocated, but these are not very good tests. And hence now liquid biopsies are emerging, which is just a blood test at a yearly basis. On a yearly basis, I generally recommend doing it with Datar Genetics. They have three FDA fast track approvals in liquid biopsy, and these are still under advanced research, but I personally believe that screening measures will take decades to complete research, and so if there is enough evidence, even from a fast track FDA approval basis, we must go ahead and do them and participate in the screening. For males, it's prostate cancer screening. For females, it's also cervix cancer screening, with doing pap smears once in every 3 years. If there is an abnormal pap smear, you have to do it yearly for your entire reproductive life. Cervix cancer is also highly preventable. If there are young girls in the family in between the ages of 11 and 13, we should give them cervix cancer vaccination. This is now a routine in the West, and in India, it is being given for free by the Indian government for all girl child, and even for boys in that age
Yeah.
group, because HPV, human papilloma virus, is is a carcinogen that can cause. It has a very high cause and effect relationship. 98% of cervix cancers are as a result of HPV virus. So we must advocate giving cervix cancer vaccine, and also this is a vaccine that can be given to boys, because now we are in a new age where boys are also at risk for oropharyngeal cancers, for genital cancers, and we must prevent them. This is a highly preventable disease. Ballpark, this is what we recommend for screening.
Absolutely understood. As I spoke about yesterday's news that came out of actress Priya Marathi passing away due to cancer, she was just 38. And of course, we've all seen so many cases where people are 60, 65, and they survive. When somebody passes away due to cancer at such a young age, in their mid 30s or late 30s, uh, what do you think is the biggest cause here?
So, cancer biology is different. We cannot equate one person's cancer to the other person's cancer. The next person may have a very different cancer. So, one here, one has to give a chance to every person. I'm a huge advocate of personalizing therapy for cancer and not treating patients as one size fits all. Um, I call it bucket chemotherapy. We cannot give bucket chemotherapy to everybody. We have to understand what works for that person, which pathway is active in their cancer, and what drugs should be utilized in their treatment. And so, personalizing someone's treatment should be the norm, and giving precise personalized treatment is something that I've advocated all my life, and I continue to do that. And that's where one has to really try hard to figure out what is that particular person's signature and design the therapy accordingly.
Last year, I don't know if you know about this, but Navjot Singh Sidhu was in news a lot because his wife was diagnosed with cancer, and he claimed that she was able to beat it in just 40 days with no medical help, with 0 rupees spent on her treatment, and only a change, major change in her diet, like consuming turmeric water, lemon water, and having a healthy diet, and then doing intermittent fasting. Now, a lot of doctors came out and spoke against it, saying that only a diet can't fix cancer. But I would really like your expert opinion on this.
So I generally don't want to directly comment on such um, disclosures, disclaimers. I just don't. Um, I think this is misguiding people. I would strongly recommend people to stay with what has more evidence, and allopathic medicine largely follows evidence. We practice evidence based therapy, whether it be chemotherapy, targeted therapy, immunotherapy. All of that is all very, very highly backed by um, data, and that is what should be followed.
Okay, got it. Can a healthy diet in general lower your risk of getting diagnosed with any kind of cancer?
So, in general, healthy diet promotes healthy healthy outcomes,
Okay.
which includes cardiovascular outcomes and cancer outcomes. That is, in general, the fact. However, in terms of preventative health, there is deficient data as to what all in diet could really be preventative for cancer. There are some diets which we largely understand as being protective. One such diet is called Mediterranean diet. It includes
Okay.
legumes, nuts, poultry, and uh, excludes red meat, alcohol, and of course smoking.
Okay. uh, of course, you've helped actor Sanjay Dutt uh, come out of his cancer, and he's spoken about it and how he came out of it. Um, a lot of times when somebody announces that we're dealing with this, they put out a statement, everyone gets very scared. When you met him first, what was his treatment like, and how did you make sure that he bounces back fitter?
So, first of all, I would like to say that it wasn't actually me that helped him get out. I think it was his cancer biology. I think that's the message that I would like people to walk away with. No doctor is a magician, it's the biology of the disease. And finding that biology was my only credit. So all I did was to recognize and identify that he had a marker which would put him at an advantage to being treated with immunotherapy. He had very high PDL1 score, and he will tell you that because he memorized it. This was his savior. So he had very high PDL1 score, which was a marker for advanced and enhanced response to immunotherapy. And that's what we saw. We treated him with chemotherapy and immunotherapy. He has been truly very brave with his treatment, and he was completely disciplined with his treatment, with his diet, with his exercise, and throughout his therapy and his recovery, and even till date, even this afternoon, I have several messages from him which are screenshots of his treadmill. So he is exercising heavily, and he exercised during his therapy. And now, if you see data all across in our gospel, in oncology, in our leading journals, we have data coming out that exercise decreases recurrence, exercise enhances survival in cancer patients. So, exercise and organized weight loss with
Okay.
diet and exercise. So Mr. Sanjay Dutt lost 12 kilograms of weight, but that was not weight loss due to lack of appetite from treatment. That was organized weight loss, very well thought out, organized with diet control and exercise. And I think he worked very hard, and well, congratulations to him, and we are blessed to have him amongst us uh, with complete response and cured.
Absolutely. Lastly, of course, there are so many things spoken about injectables and getting Botox or doing any kind of skin treatment that injects something into your body. Now, I recently spoke to a dermat who spoke against it and said that we should not, it's harmful, and we should not be doing something in excess. Excess of anything, as we all know, has always been harmful. Uh, do you feel even these things intervene with your physical health and how your body functions?
So actually, I would just say excess quantity of anything may have an implication. Otherwise, these are all medically approved treatments, and there is no contraindication to Botox from a cancer perspective. So, no red flags like that. But of course, anything should be used in moderation, because long term data with regards to cancer causation and those trials have never been run, will never be run. And so we have to be very cautious and utilize anything in moderation.
Okay. Lastly, if you had to give top three or the most important advice that you would give to somebody who's currently battling cancer, what would that be?
So I'll talk about all comers top three
Okay.
recommendations. So, for the ones who are already facing it, this is a battlefield. Have faith and battle the hell out of the disease. So,
Yeah.
stick it out, hang in there, and much more and more power to each one of you who's battling it. My heart goes out, and my all my support and my prayers for the people who have not been diagnosed, or who are regular people, the regular masses,
Yeah.
um, general people. I would say, let us all rise, stand together. Let this be a revolution owned by the people. Let us all stand up, stand together, hold hands together, and own screening, own cancer screening. Let us all own cancer screening, revolutionize the way we are looking at cancer in our country, and own the screening, so that we can red flag our symptoms, red flag our family histories, and catch this early or prevent if possible. And lastly, we must be aware that cancer is an epidemic. We could discriminate against cancer, and someone may be changing the channel just as we present, as we talk. But cancer could still strike. So
Yeah.
better be aware than sorry. I think today the time has come to be open about it, to discuss it as openly as we did COVID. And that's how we'll be able to battle it together and stand up against it with full force. So, time has come for all of us to be together, united against cancer. And that's the biggest voice and biggest message that I would like to leave here with.
On that, thank you so much, Dr. Sewanti, for joining in. It has been such an insightful conversation. and you've saved so many lives, I'm sure, and you've spoken about it with
Indeed.
utmost honesty. Thank you so much for joining in. All the very best. Thank you.
Thank you, Free Press, and thank you, Rashita, for having me.
You're most welcome.